Hi everyone, I'm Dr. Lao Rodriguez. I'm from Mexico City. I'm a dentist specialized in implant dentistry and aesthetic dentistry. So Olonex is a very straightforward procedure nowadays because it allows the patient to have a fixed a prosthesis and a X amount of implants, right? So how do we pick the number of implants? Well, this is based on a patient's own habits, patient's own biology, patient's own bone, patient's own biomechanic. So what we do is we do a full assessment of the patient, bone of the patient gums, of the patient features, and we try to determine the ideal position of those implants, and then we could determine the number of implants that we're going to be placing in each case. First, we have to determine the aesthetics of the patient, right? Every single case is different, and we don't try to put all the patients in one box and treat them the same way, right? So we try to customize each treatment for each patient. So it's super important that we plan the case properly. That's why we take preoperatively pictures, preoperative scans, CBCTs. So when we go to the surgery, we know exactly what we're gonna be doing, because we're planning everything in computers, in softwares. That's gonna allow us to actually see the outcome before even touching the patient, right? Before even opening the gums and placing the implants, we just know exactly what we're going to see. So knowing this is very important because we can know precisely the bone density, we can precisely know the type of implant that we're going to be using, the angulation that we're going to be putting on those implants, the length of those implants, the diameter of those implants. All of these are very little things that come into play when we have the final outcome, right? The goal is not to place X amount of implants, is to give the patient something to smile, to chew, and something for them to go and live life at its fullest without being worried about something removable or something that is not going to work for them. The procedure itself, as I said before, it's really straightforward because we plan it before the patient comes into the office for the surgery day, right? So we'll have different consults with the patient before, just to take scans, to take CBCTs, these like 3D X-rays, you know. So we use those to plan everything ahead. And then once the patient is here for the surgery, we just try to be as quick as possible so the patient is not like a long time in the chair, and we try to put as many implants as we need, right? So there's cases that we may need 4, there's cases that we may need 6, sometimes we need 8, depending on, of course, the length of the implants, if we're putting the prosthesis in the same day or the day after. If we're immediately loading the case, then we need a little bit more implants maybe, or if we're going to immediately load the case, then we're gonna have maybe longer implants. But the process itself of the surgical part, it takes maybe between 1 hour and a half to 2 hours and a half, more or less. And then once we scan everything and have the proper design, then we can print out the design here for a provisional restoration, right? That provisional restoration is highly biocompatible. It's made out of very aesthetic resins that they're very durable for this transitional phase between something provisional to something final, right? So the process itself may take like up to 3 hours, maybe 4 hours in general, but the surgical part, it's the one that it's I would say faster, because it's the one that we do first, and after that we just have to wait for the provisional to be printed, and so we can place it, and that's it. So we try to put in the implants very tight when we place them. So so we know it's gonna be safe for them to carry a provisional, right? To load them with a provisional restoration. But we recommend to the patients that they don't eat very hard things because mostly the provisional is gonna be for aesthetics and for just chewing maybe some food for just a short period of time. And after the implants integrate, then they're gonna be able to eat whatever they want, of course. But we just ask them to just take it a little bit easy of this provisional because we don't want to damage any of the integration of the implants. And we try to give the patient as much as confidence as possible after the treatment during the post-ops, right? So the great thing about doing these treatments in-house is that we're mostly in control of everything that we do, right? So we're in control of the surgical part, we're in control of the restorative part, which is the part that we do here in the clinic. Since we're able to 3D print the prosthesis, then we can make more modifications if in case they're needed. In case for example, the bite is off or the aesthetics are not good, we're able to just in 30 minutes to 3D print another restoration, right? We're able to design it in-house, we're able to print it here, so in case something comes up, we have the ability to do that. And then right after we let the implants heal for a while and integrate to the patient's own body, then we go ahead, take new measurements, take new scans, sometimes new impressions, verify that every single thing is gonna be working properly for the final restoration, and then we give the patient the final full arch restoration or the final prosthesis, right? So that's the whole goal, right? To give the patient something very, very strong, something that it's gonna last for a lot of years, and of course something that's gonna help them chew properly, that is gonna help them digest the food properly, and also give them this smile back that they most of them are wanting to have. So the whole idea is to just try to help them as much as possible during all these phases, and of course taking care of them during this process. So also the final material of this prosthesis is made out of a very, very highly aesthetic material. So of course, not because it's aesthetic, it's gonna be fragile, right? So we have the ability to do zirconia restorations for these type of procedures that will last a very long time. That is gonna be attached to the implants, it's gonna be fixed to the implants, and it's gonna help the patient function properly. We were born with fixed teeth because that's how we're supposed to have our teeth, right? They have to be fixed. So having a removable denture without any kind of implant would actually make the patient chewing process very hard, because the denture needs to be stable while they're chewing, right? So if the patient just bites on an apple, of course it's not gonna hold properly, right? Even though the dentures are very well made, there are a lot of limitations with this, with a completely removable prosthesis, especially during this speaking process or during the chewing process. It's gonna be a little bit challenging for them, especially if they're if they haven't worn any removable restoration before. On the other hand, we have the overdenture overdenture cases, which is detachable prosthesis that goes in either 2 or 4 implants. And this type of process, it's very, very, very nice. It's much, much better for the patients, rather to have like just a regular denture. And we have like as an outcome that the patient is going to be able to chew better, the food is going to be a little bit better with the speaking part, so the patients can pronounce words much, much better, especially if patients are like first time having this type of procedures done, like full mouths. Then they're gonna really adapt much, much better using this type of prosthesis. And we like them because they're much more retentive, they're much more stable, and patients can function way better with these ones, right? And of course, as I said before, the best treatment would be having something fixed, right? Why something fixed? Because having something removable will actually do not prevent further bone loss for the patient, but having something fixed will actually increase and actually would stimulate the bone properly, like a regular teeth does. So we're going to preserve more bone with this type of procedures. We're gonna have something fixed, and we're gonna be able to give the patient something that will be much more comfortable than something removable, right? This type of prosthesis, we put them in the office and we screw them in here, and the patients will not take them out at home, and they will function much better than a regular denture or overdenture. And it can increase the chewing process up to like 90%. Is very similar sensation to having fixed real teeth, right? So this will be the best option. If you have a missing tooth, or if you are going to have an extraction done, it will be better if you have a consult about implant beforehand, and we can inform you about all of the process of how it works, how is the healing times, and of course having implants done in an office which have all of this technology. It's very good because in case something happens, we're prepared to solve any kind of problem, any kind of issue, or any kind of complication during the procedure, and we can do it right away thanks to all this technology that we have. And if you're curious about implants, if you're curious about the process in general, we are more than happy to have a consult, so we can go step by step and inform all the patients about all these type of procedures and what type of procedure that will be most suitable for them.